How is palliative sedation different from euthanasia? Have you ever wondered how palliative sedation differs from euthanasia? These terms often come up in discussions about end-of-life care, but they representing very different approaches. Let's break it down. Palliative sedation is a medical practice aimed at relieving severe suffering in patients who have symptoms that cannot be managed by other means. It involves intentionally lowering a patient's level of consciousness, sometimes to the point of unconsciousness. The key point here is that the goal is to alleviate suffering, not to hasten death. This method is typically used when all other treatments have failed and is seen as a last resort. The sedation level is adjusted based on the patient's distress and is maintained only as long as necessary. Importantly, palliative sedation does not intend to cause death. It is ethically justified when it does not shorten a patient's life expectancy. Patients or their surrogates are involved in the decision-making process, ensuring that their wishes are respected. Other treatments, like managing symptoms and sometimes providing hydration and nutrition, continue alongside the sedation. On the other hand, euthanasia is a different story. This practice involves actively causing a patient's death to relieving suffering. It is an intervention with the explicit intention of ending life, often through lethal substances. The ethical debate surrounding euthanasia focuses on the morality of intentionally causing death, which raises significant concerns about the sanctity of life. Euthanasia is irreversible and directly results in the patient's death, setting it apart from palliative sedation. From an ethical standpoint, the main difference lies in intent and outcome. Palliative sedation aims to relieving suffering without causing death, following the principle of double effect. This means that while it may unintentionally shorten life, the primary goal is symptom relief. Euthanasia, however, seeks to end life to alleviate suffering, which many ethical frameworks find troubling. In practical terms, palliative sedation is only applied after a thorough evaluation by a healthcare team, when symptoms are severe and all other treatments have failed. It requires careful monitoring for symptom relief and potential side effects. Decisions about hydration and nutrition are made in consultation with family members. Euthanasia, conversely, involves a different clinical and legal process, often requiring explicit patient consent and adherence to specific legal criteria where it is allowed. In summary, palliative sedation is a medically accepted practice to relieving unbearable suffering without intending to cause death. Euthanasia is the intentional act of ending life to relieving suffering, raising distinct ethical and moral concerns. Understanding these differences is essential for informed discussions about end-of-life care.